feel out the joint. You let me know if that feels tender at all. Okay. As I come down at the wrist. Okay. We'll try this side. I want you to just try to keep your hand parallel to where it is. Notice kind of a gradual dropping there. Again, not as prominent on the wrist. So your elbow, definitely a little bit of nerve isolation there that we might have to test further. You close your eyes for me, Samantha. Sometimes if you're not looking, your body kind of relax a little bit more naturally, so just try to relax for me. Maybe a little bit ticklish, just kind of gentle. I just want to see if you notice any twitching, any signs of accommodation. So we're going to go ahead and get started, Samantha. I do want to ensure that we are testing a few different things. Now, I was speaking with the physical therapist and he did say that there was still some weakness happening.
Yeah, I'm not being able to lift as much as I was used to before.
Okay, so it hasn't really gotten better. Do you feel like it's gotten worse at all, or it's just not improving?
It's not improving.
Not improving. Okay, so you've had enough sessions with PT now that I would like to see a little bit of improvement. So it is just mildly concerning. I want to make sure that there's no permanent damage. So like we talked about in your last follow-up assessment, what we're really ruling out at this point is whether or not you're ever going to return to your baseline strength. Okay. So today we're going to be testing a couple different things. I'm going to kind of rule out if I think this is more an issue with that same ligament that was damaged, or if we've kind of damaged some of the nerves in your arm that are then impairing your neurological function, essentially. Okay. All right. So I will do like a basic physical assessment, of course, perform a visual examination as well. So I do just want to ask you, are you experiencing any pain in the limbs?
No
pain. Okay.
I'm just I'm feeling more weak than I was prior to the incident.
Okay, all right. So definitely something that you're noticing. And, okay, so no pain. Any sort of like burning sensations or any like tingling? Do you find that your upper extremities are like maybe falling asleep irregularly a little bit? Okay, so I'm going to test for some circulation issues as well to see if there's like a lack of blood flow again versus ruling out any sort of neurological symptoms. So no like burning, tingling sensations that you're aware of. Okay, all right. I'll do a temperature assessment as well. Your hands do feel very, very cold to me, so that's something that we will look at as well. All right. And as far as the issues with your strength, would you say that you're having trouble with like everyday objects? So something as simple as like holding your phone or...
No, nothing like that. I think it's if I were to lift something heavier.
Okay, so just your overall strength capacity you feel is diminished. Okay. And how about any issues with dexterity? So as far as like being able to write, normally holding a pen or a pencil or utensils while you're eating?
Utensils are okay, but my writing isn't as
I do feel like it's okay. All right, so maybe some issues with the fingers. So definitely have a look over at the digits as well. And then have you noticed any swelling? So any swelling of the joints, any swelling of like the knuckle area? Nothing like that. Okay. And then no issues overall with like skin, no rashes or anything extra?
No, that's okay.
Okay, all right. So I'm going to go ahead and do a bit of a visual assessment. So to start off, I'm just going to kind of have a look at the overall alignment. I just want to see if there's any issues kind of musculoskeletal, so just looking at your bones. Shoulders are very well in line. I don't notice anything there, so nice even symmetry as we come down to the elbow, which do appear to be midline with chest wall, which is good. Then as we come down to the wrist, I'm just going to move your hands here slightly. So just having a look at the wrist as well. Looks good. And then we'll just extend up the fingers. So again, just looking for just kind of overall symmetry there and length as well. And that does look okay. Then if I can have you just rotate up for me. So again, starting at the shoulder. I do maybe notice a mild difference with the inner elbow there. Some misalignment, but nothing that's... So again, at the wrist, we're kind of a half an inch difference there. So even pronation at the thumb. Okay. All right. So let me go ahead and begin with a little bit of an inspection with my light. So I'm just going to shine this kind of over the skin, have a look at things externally and see if there's anything that I notice there as far as like swelling or abnormality. Also have a look at some of that veinage there. Okay. So just relax for me. I'm just going to have a look. Starting up at the shoulder, I'm going to come down. The skin is very smooth. So overall, just looking for any abnormalities. I do see a little scar there, but I don't think that's related. And I'll just look at the outer arm here as well. Okay. Again, another superficial scratch there. Okay. Alright, we'll go here. Just give that a little freckle there. Externally on the left side, I don't notice anything particularly abnormal. Okay. So just come over on this side as well here. So I'm going to start up at the shoulder. The skin is honestly very nice and clear, so no signs of anything really dermatological. I don't notice any rashes or any signs of eczema. There's no flaking that would be associated with like psoriasis. A couple just like superficial abrasions. Got a little scar there as well. Okay. Now, if at any point you get injured, so you know some of these little scratches, do you think you're bleeding abnormally heavily, or they kind of heal?
No, they heal
pretty normally, no
quick,
excess
yeah.
bleeding or anything like that, or
No.
issues scabbing over. Alright, okay. So, really, as far as your skin is concerned, I don't notice anything that I would say is concerning. Okay? So I'm going to do a temperature assessment because I do feel quite a bit of difference here versus up here. Now, I would say, I'm just going to move your hair here slightly. Up at the shoulder, we are a little bit warmer. I would say kind of as a whole, your skin is a little bit on the cooler side. Definitely starts to diminish here at the elbow. So as we come down, pretty noticeably colder about mid-forearm there. And then hands certainly are very, very chilly. Much worse with the fingers. Okay. So I'm going to come at the back of the arm as well. Actually quite a bit colder there. Right, and then as we go down, I'm just going to feel individually here, kind of underneath. Nice and warm at the joint. fairly cold at the digits, but even throughout the hand. So there aren't any fingers that are, you know, warmer than others. Palm is maybe mildly warmer there. Let's do the same on this side. Again, slightly warmer at the elbow. Then as we come down, it's a little bit colder here. Actually, I think this side might be just a tad cooler. Okay, all right. Secondary assessment here. I'll just go in and double check with my thermal gun. Just get a baseline reading here, just so we have kind of an average for you. We're at about 98.7, so just keep that in mind as we come down. So already at the start of the arm, we've jumped down to about 97.1, which is still normal. Coming down 96.9. Just gonna rotate your arm here as well. Slightly warmer at the underside. Okay, alright. Let's test again on this right side. So, looking for kind of an average between the two sides as well as any significant difference as we come down the extremity. I would say as a whole, temperature is lower than what I would consider. So you're actually getting a low reading there, so can't quite pick up your body temperature there. So we'll try this side. Okay, so we are actually cooler on this side. Not by much, but noticeable variation there. So lowest temperature we're getting is about 90.5, which is quite low in comparison to your carotid temperature, which was closer to about 98.6. So just something to keep in mind. So I'm going to clean my hands. And we're going to perform some palpations of the extremities. So I am going to be feeling around with my hands, do a couple different variations of palpation. So first we'll do a bit more superficial, where I'm just kind of feeling surface level for any edema, any swelling, anything like that. And then we'll do a little bit more of kind of a firmer pressure that will allow me to feel a little bit more inside of the muscle and things like that. Okay, if at any point any of it causes you any pain or anything is tender, please do let me know. So I am going to put on a pair of gloves for this portion of the examination. All right, so I'm going to start on this side. So I'm just going to feel very superficially to start with. Just kind of gently grazing my hands over the skin. I want to feel for any abnormality in skin texture. The gloves kind of allow for a smoother glide across the skin. Feeling for any textural abnormalities. Overall, it feels pretty smooth at the upper portion of the arm, and then as I come down, over the scar here, it doesn't feel raised at all. Some residual discoloration there. Just going to have you rotate for me. I just want to feel the inner portion of the arm as well. Don't feel anything externally at the joint. Just going to feel the hands. Just going to have you bring your arm back slightly for me. Perfect. Just going to feel the fingers individually, feeling for any signs of external swelling. So far not notable. Your skin is very smooth, nice and soft. Normal distension at the knuckles. Do have one more prominent mole there. Alright, so we can relax this hand. I'm going to do the same on the other side. So again, we'll start up with the shoulder. I'm just going to move your hair here slightly. Any areas of tenderness or anything so far? Again, overall skin texture is very smooth. So sometimes at the upper kind of arm from shoulder to elbow, we get these little bumps, but I don't feel anything on your skin. It doesn't appear to be a nice mix of dry to the touch, but also moisturized as well. I'm just going to rotate here and assess the inside. Overall skin complexion as well is nice and clear. I don't see any signs of abnormal pigmentation on either end of the spectrum. Palms. Alright, so I'm going to do a bit of a deeper palpation now, so nothing super rigid, just a little bit more of a firm motion. Okay, this time I'm going to do bilateral, so I'm going to feel at the same time. I want to feel if there's any differences from either side. So I'm going to start the upper shoulder. Just kind of firmer motions as I come down. Feel at the elbow. Nice and even distension there at the joint. Good. And then as we come down the forearm, don't notice any abnormal distension there as well. Just going to feel at the wrist joint. And if we do the fourth digit, right. And I'm just going to feel at the thumb. Now if you flip your hands for me, I'm going to feel once again at the underside, just a light pressure here. Okay, alright. So I'm now going to do some palpations of the joints individually. So just want you to kind of rest your elbow. I'm just going to feel here. Any discomfort as I palpate here? And then I can take them off. That's okay. I'll just move them up slightly here. I just want to feel directly along the bone. So just kind of feeling for any signs of displacement or abnormal mobility. If we're flexing a little too much, then that could be concerning, but don't feel that either. A little the inner wrist as well. Okay. Not feeling any particular abnormality at the knuckles. Sometimes we worry about things like arthritis or swelling. Even see issues sometimes with lymphedema of the hands. And then of course I'm just going to check for normal blood flow, capillary refill. Actually very well intact for how cold your hands are, so that's a good sign. Some maybe just a mild deficit there at that first finger. Okay. Okay, so your thumb. Might need to do some testing isolated here because I do see just a little bit of difference in return of blood flow. So we will come back to that. I'm going to do the same on this side. So again, I'm just going to feel out the joint. You let me know if that feels tender at all. As I come down at the wrist. Signs of rigidity or distension there. That feels okay. And same along the knuckles. Then as we test for capillary refill, I'm looking for any differences in bilateral return, and I would say I think it's about the same on both sides. Let me see this hand. I just want to test even here. No, it's definitely worse on this side. Okay. Do you notice in your difference in strength that it's asymmetric? Is there one side that you feel is particularly weaker compared to the other, or does it typically feel about the same?
No, I think it feels about the same sometimes, and other times it leans more
It feels
on one
different.
than the other.
Okay. But when it changes, it's not the same side that's typically stronger. It kind of just depends.
Yeah.
Okay. All right. That's okay. Okay. So I do want to just have a look quickly at the nails themselves. So just looking for any signs of damage, abnormality in texture. Sometimes if nail texture itself looks concerning, then that could be something to look into, but yours does actually look okay. Nail beds are very healthy, nice and clear. Cuticles are well manicured. I don't notice anything of concern really there. No discoloration of the nail or nail bed itself, which is a good sign. Do you typically keep your nails at this length, or does it kind of vary?
No, I actually cut them about a week
really?
ago.
Okay, so they're usually longer than
They're
this?
much longer than
Okay.
this.
Alright. Nails themselves are very strong. Doesn't appear to be any weakening of protein. That's good. Alright. Okay. So let's move on then. I'm going to go ahead and take my gloves off for now. Just cleanse my hands once again. Okay, so we have several other things that we will be testing. I think I am going to go ahead and obtain a couple of measurements before we proceed. So I have a variety of tools to measure with, and I think to start with we should just kind of get a base for the overall symmetry of the extremities themselves. So just have you sit kind of even for me. Your arms can be in any position at this point as long as they're about the same on either side. So I'm going to use this tape measure here. I'm going to start with the shoulder. 9.5 inches there. So the measurements themselves are kind of arbitrary. We're really just looking for differences in symmetry. So it's not really, you know, whether the length of your arm is a certain length doesn't really matter. Everyone's anatomy is different. More so just measuring to see if from any one point to another, there's a degree of difference on either side. So for example, this side from your elbow to your wrist, right at about 9.5 inches there. So then comparatively, about the same there. So just bring this underneath. And right at 6 inches there. Do the same on this side. Actually, slight difference here. So we're at about 6 1/8 on this side, which I would consider to be normal variance. And then if I can have you just extend flatly here. Let's say about 3 3/4 there. Only about 1/8 of a difference there. Closer to 3 inches. About 2.5. It's about even there, and then just return for me. So for the thumb, we measure at 2 different points. So for the first point, I'll measure here at about 2 3/4, and then we'll go all the way to the joint at about 4.5. Again here. And then about the same there. Okay, so that's good. So as far as symmetry, you are fairly even. And then we will do a bit of an extended test here. So I'm going to have you just extend your arm straight out in front of you. Actually do notice a bit of hypermobility at the elbow. So that's something to note there. Okay. And as I come down, 2 inches from the elbow there. Okay, you can relax this arm. So we'll do the same thing on this side. So you definitely have some hyperextension at the inner elbow. Have you ever been told that you have hypermobility?
No.
No. Okay.
I always thought that was normal.
I don't know that I would say it's abnormal. I think you just have a little bit more joint mobility than I would say is average. That's okay. So if I have you extend both of your arms, so you see how we're kind of convex there on the inner elbow, actually more so on this side. So I am going to measure that. So I'll have you just keep your arms there for me. About a 1/2 inch difference at the bottom. Okay, definitely more so on the left side. Sorry, just keep your arms there for me for just a second. I'm just going to actually measure that curvature more precisely. 4 inches on the left side. You can relax that arm and then just keep that one extended for me. Okay. Sorry. That's okay. Alright, so like I said, there was about an inch difference there, so just something to note. I do just want to see if there's some kind of hypermobility of the wrist as well, so I'm just going to have you kind of keep your elbows on the pillow and then wrists mildly elevated above. And then if we can bring our kind of wrists out like this. Okay, so maybe just a little bit there. And then if we come back to the center and then go in. And then back to center and up. And center and down. Okay, all right. So not as much as the wrist joint, but okay, all right. So let's see. There's a couple other things that I wanted to get into. Let's go ahead and just do some reflex testing. So we can start on the side. I'm going to just kind of hold your hand here. A little movement at the wrist. And then if we rotate here, slightly diminish there. Okay. Good. So same thing on the side, so just kind of relax for me. Slightly diminish on the wrist, both sides there. Okay. Try a little bit more precise testing. So I want you to just kind of relax all of your weight into the pillow. Good. Maybe you close your eyes for me, Samantha. Sometimes if you're not looking, your body kind of relax a little bit more naturally, so just try to relax for me. Okay, so I'm going to do the same thing with the fingers. Okay, so same thing on this side. A little bit more permanent on that side. Okay, so your reflexes, I would say, have actually been affected just mildly. So I'm going to test a variation of that. Let's see. I'm going to test a couple of passive reflexes here. So just want to see if there's any twitching. Might tickle just a little bit. I'm producing a vibration sensation directly on the bone, so bone conduction, sometimes we'll see some twitching of the nerve, which is not present. Oh, actually mildly there. The ulnar region. So your left side, I would say, is about 2 degrees. To look into that a little bit further, I'm going to do the same thing here at the wrist. Not quite as prominent there. I'm just going to do outer as well. as prominent as at the elbow. Right, and we'll do this side. Do you find that with these issues with your strength, I actually did notice this time more lateral versus left side was more center. Do you find that your issues with your strength have affected your preference of which side arm you're using? So, okay, so if you're having trouble with your strength, then you're kind of compensating maybe on the other side versus you wouldn't normally use that as your dominant hand. Again, not as prominent on the wrist. So your elbow, definitely a little bit of nerve isolation there that we might have to test further. Not as notable on the wrist. Okay. So I'm going to stimulate the nerve a little bit. So I'm going to turn this on. And it'll take just a second. Okay, so I'm going to place this directly here. And so definitely getting a reaction there, that ulnar nerve. There could be some inflammation inside the arm, but I definitely feel some activation there. Okay. So same thing on the side. Again. Mild reactivity there as well. Okay. I do think it's more prominent on that left side though. All right. Okay, so I'm going to do some passive reflex testing. Let's see, I want to do this a couple different ways. Actually, we'll start here. So I'm going to have you kind of rotate and then bring your elbows parallel to the rib cage there. So just like that for me. And then I want you to just really relax your hands. So just kind of relax there. I'm going to have you close your eyes for me. I'm going to touch your hands with a multitude of objects. This is doing some kind of passive reflex testing for the nerves, looking for any isolation that needs to be tested further. Okay? So maybe a little bit ticklish, just kind of gentle. I just want to see if you notice any twitching, any signs of accommodation. So this test isn't really measured in pass or fail. It's more so markers of abnormality. So far I've seen 2, both of which on the right side. Keep your eyes closed for me. I'm just going to switch tools. This time you're just going to feel a softer sensation. Same thing. Not quite as reactive here, just softer sensation. Actually, did see a mild reaction there. Okay. Let's try. Just feel something like this. Just stretch your fingers out for me just a little bit. quite as reactive. Is that right side? Don't want to startle you. This time you're going to feel a very cold sensation, okay? I know that is rather cold. I apologize. Okay, just a little bit of reactivity there as well. I'm noticing some compression of the nerve actually. So I'm going to test one more variable in this portion of the examination. Again, just going to give you an example up at the chest wall. So this time you're going to feel a sharper sensation there, okay? Stretch your fingers out here. Normal reactivity here. Okay, you can open your eyes. So for that one, I actually didn't notice any deficit, so that was okay. So with your eyes open, I'm just going to touch you with my hands this time. So I don't know if you can feel it within your hands, but I can see a visible difference in the outer portion of this side. Do you feel any twitching?
Maybe
A little bit. Okay. So I'm going to have you hold your hands kind of suspended for me, just like that. So I do notice just a little bit of weakening, kind of dropping at the wrist. Do you feel like it's fairly difficult for you to keep your hands suspended? Is it any harder here versus here? About the same? The same at the thumb? Okay. Then if we flip your hand over, it's actually a little bit better. Definitely stronger at the dorsal side. Okay. So I'm actually going to place an object in your hand. Let's see. Okay. We'll try this side. I want you to just try to keep your hand parallel to where it is. So we noticed kind of a gradual dropping there. And then if we rotate so that more of the weight is on the outer portion of your hand, slightly more balanced, so definitely more so isolated there. Okay, so we're going to do the same thing on this side. I'll start here. Definitely more difficulty with this side for sure. Okay. Okay, so this side has a bigger deficit that's noticeable to me. Can you feel that difference there? Yeah. Okay, all right. Let's do some isolated strength testing then, because I'm definitely seeing a difference on this side, at least for today. So I have a couple different variables here. So this is kind of a stage 1 marker for strength. It isn't very taut, so it should be fairly easy for you to pull apart. So I'm going to place it in your hands. I want you to use as even grip as you can and pull it apart. And let me know if you feel a difference in either hand. Does it feel about the same level of strength it takes you to pull it?
Right now, yeah.
Okay, all right. So that's good. So level 1 is about even. go up. So this one, it's about a level 3. It is a little bit more difficult. It takes a little bit more force. So same thing.
This one I can't pull as much as this one.
Okay, so I'm going to hold it here in the middle. I want you to pull with that hand and then with this hand. Okay, so definitely a degree of difference there. And then we're going to try up and down. So again, I'm going to hold in the middle. I want you to pull up. With this hand, pull down. Okay, all right. Okay. So now we will do some bilateral testing. So I'm going to place a putty. You might have actually used this with your physical therapist. I'm going to place a putty in both hands, and we are going to test for bilateral difference with identical pressures. I'm going to start with your hands up. I'm going to place them both in your hands. I want you to squeeze them evenly. Okay, so definitely we can see that there's more prominent indentation here versus on this side. So I'm just going to kind of reform them a little bit. I'm going to place them back in your hands. I want you to rotate and hold your hands like this. And then same thing. So we're going to make a fist, tight, tight, tight. A little bit of difference here. Okay. It's actually a little bit better, but we can still see that there's quite a bit more indentation here. So for today at least, the deficit appears to be worse on that left side. All right, so I can put these away for now. It's very interesting. So at this point in the examination, I'm kind of leaning towards there being a compression of the nerve. So I just cleanse my hands quickly. I am going to draw a couple of symbols in your hands one at a time. I want you to try to assess what they are. So for example, we'll start with your eyes open. If I draw this here, an 8. Okay. So we'll repeat that same thing, of course, with your eyes closed. Okay. So we will start with a digit.
1, 7.
It was a 7. Very good. And I'm going to give you a capital letter.
B.
Good. Another capital letter.
T.
Very good. And one more digit here. We will do
9.
Very good. So same thing on the other side. You did very well there. So again, can we tell that that is again a figure 8?
Mm-hmm.
Okay. So same thing here. We will start with a digit.
6.
Very good. Capital letter.
Z.
Good. Another letter.
T.
Try that one more time.
T.
Okay. And then we will do another digit.
3.
And I'm going to do one more letter just to be sure.
W.
Okay, all right. So that second one was an X, but the variable is similar, so that's okay. It's very understandable, miss there, so that's all right. So now I am going to touch various fingers with this object, so something like this. And as I touch the finger, so this will be an eyes closed examination. So for example, if I touch here, I want you to then move the finger that I've just touched. Okay. So we're touching for kind of perception here. So eyes closed for me, and we'll just kind of loosen up at the joints there. Very good. So good. So that was okay, actually. And lastly, in the same line of testing, when you keep your eyes open for the demonstration, I'm going to move different fingers either up or down. So towards you we'll say is up, towards me we'll say is down. And I want you to just call which you feel, okay? Good. Now for your thumb, obviously we'll do in and then out. Okay?
In, out, in, out.
Okay, good. So there's no real deficit with that, so that looks okay. So we're gonna pivot to something else. Just gonna do some inspection here. I just wanna see if there's any hardening or callus. Appears fairly pliable, so just testing for any rigidity. Your skin is very soft, even at the folds here. That feels nice and supple. I don't notice any hardness, nothing that's particularly tight as well. That feels okay. The thumb as well. I'll just have you turn your hand for me. This feels pretty pliable. I don't think I'm noting anything of concern there. Okay. So just do the same thing on this side. See if there's any differences. Actually looks okay. Alright, you flip your hand over for me. Test lastly at the same. Actually, you may feel just a little bit of variation there. Just slightly more taut, but nothing that's... Alright, okay, that looks okay. Okay, so let's see. Do you want to... There's a little bit of tape here. Just stick that to your finger for 1 second so I don't lose it. Thank you. So I'm going to place this on the back of your hand. We're just going to very gently smooth that out. And I'm just going to check for any abnormal dislodgement of skin cells. So again, kind of superficial external assessment. So then we will peel that off. And I can then assess for any differences in skin integrity. So I apologize as this is just a little bit sticky. Paper tape, it shouldn't hurt you too much. Okay. So I don't see any abnormalities on the tape itself. And then if I look at the hand, it does look okay. No redness, no obvious signs of irritation there. All right. Do the same on this side. This side actually does appear to be slightly varied. A little more dislodgement of skin cells here, actually. Okay. So I'd say your left side is slightly more delicate at the skin. Externally is just a little bit more dry, which could again be an issue with circulation or some of that nerve compression. So all of these tests combined just kind of tell us that there's a little bit more variation happening on the left side. So. All right. I want to do a little test for grip strength. Just cleanse my hands quickly. So, apologize for the hand sanitizer. I am going to have you grasp my hands. I want you to squeeze evenly. So, bilaterally, I feel some weakening on the external digits, but between the two hands, I do feel some deficit on this side. And then if we do here, again, squeeze, squeeze. Same thing. Okay. Then I'm going to go like this. I'm going to push down. I want you to push towards yourself. Okay, so push, push, push. Definitely there. And then if we go down towards your feet. Okay. And then if we bend, pull in towards you. That's actually about even. That's not too bad there. And then push down. There is a deficit there, though. Okay. Interesting. And we'll come in towards you one more time. And then just at the hand. Okay, so that's about even. So it's just on the downward force there, which tells me that it's more compression here towards the wrist. All right, Samantha, so I do feel there's definitely a deficit. I know you said it kind of varies one side versus the other. Sometimes it's even, sometimes it's not. For today, it is more so on this left side. I do still notice some deficit on the right side. So what I want to do is follow up with imaging. Okay. So we're going to get an MRI of, I'm going to do torso, and then we'll get a second of just the hands and arms. So kind of elbow down, and I will speak with radiology about assessing those images. We'll have a look at the nerves and see how much is being compressed, and if this is something that can be helped with more physical therapy, or if we need to look into some sort of secondary assessment and isolation. I do see actually just a little bit of deficit here. Okay, all right. So let me go put in for some imaging. I will be back in to follow up with you shortly. Okay, all